again, I have a torn meniscus that can only go to the doctor to cure it with surgery.
Yeah, well, I would use the aches treatment for that, for the pain of it. That's the only product I have that is really designed for that condition right now.
The swelling.
Yeah,
the
yeah. So
painfulness of it.
exactly. I mean, it's torn. It's not going to knit itself back together again, but it would be helping with the inflammation part of it.
Okay.
Arthritis?
Yeah.
So arthritis falls under that condition of fungus infecting bone. And so I do not have a product right now that will specifically deal with the infection, but the aches treatment will deal with the swelling component of it and the inflammation, but it's not going to deal with the root cause at this point.
Bone density?
Bone density, I do not have anything for bone density at the moment, although the treatment we just did today is going to that you just felt in your bones is designed to strengthen your bones, so maybe someday if I see that that's having positive results, a treatment like that in my clinic, then I would potentially come out with a product like that someday.
You use as many of these as you want.
Yeah, you can use it all at the same time. I don't really think you should buy them all and use them all at the same time. But, well, no, feel free to buy them all. That's okay. But there's no negative impact of multiples together.
Is there any odor to them?
It's sunflower oil. It
Sunflower
smells like
oil
sunflower oil, which doesn't really have much smell to it. Any other questions?
Just about a specification for a product, if I'm going to choose one. I have an older dog that has some health issues. He at one point actually had an acute injury which paralyzed him. He received acupuncture, and after one treatment, he was back up on his feet.
Fantastic.
The dog is almost 14 years old now, so he's certainly not running around, although he can move when he wants to.
Yeah.
But for this kind of issue, is this something that sciatica may be?
Maybe. I mean, I think the same
I
problem with dogs
I
as.
wish I brought my notes to ask you specifically which points she worked with, the
Yeah, that would be
acupuncturist,
good.
because that might have
If
been
she
a-
worked on the spine, then I would think that sciatica is a good one.
Okay.
I think that other animals suffer the same infections that we do, so fungal infections of
Right.
aging, complaints, that you're probably not going to have any impact with these treatments. Not yet anyways, but with the acute kind of inflammation and swelling that the aches would help with, and with opening up the spine and dealing with any kind of constriction in the soft tissues of the spine, then that would be a good one for that, would be the sciatica.
Okay, thank you.
Urinary tract?
I do not have anything specific for urinary tract at this moment. Although, well, the fertile essence treats infections, probably not going to help though. It's too close.
Remember the 60 seconds, 10 feet away piece of it is on the brochure, but I don't think we have television.
It's best to treat yourself when you're not within 10 feet of other people, because your energy is being moved around you. Because, like I mentioned, all these layers of energy. And the 60 seconds, I'm not sure what you mean by
You
that.
said at least for 1 minute.
To stay, yeah, roughly a minute is the energy will probably
So
have
if you
done
apply
everything
it
it's
to your
going to
dog, move away from your dog, at
Yeah.
least 10 feet.
Yeah.
to have the biggest impact. Yeah.
60 seconds.
What if he follows me to work?
Yeah.
My little lamb.
Yeah, chronic fatigue. I think I'm loaded with all sorts of pathogens.
Yeah, so I don't have a specific one for that. And again, that would be a potentially die-off kind of reaction for that, although Epstein-Barr is a major component of it, but
Yep.
fungus can be too.
I feel the Epstein-Barr data.
Yeah. I don't have a product for that yet.
I have to go
Yeah.
see a
Fungus would probably be cool too for it though.
Yeah.
When you come out.
Yeah. Someday. Keep doing it.
The 3 seconds rubbing, if you go more than 3 seconds, it's okay, right?
Okay,
It's 3 seconds.
so I forgot to tell you how to use the product, thank you for reminding me, which is you dab it, I mentioned the dabbing, and then you rub it for 3 seconds. And it doesn't matter where on your skin, although I say the back of the hand, because that's just the most convenient place. Rub it for 3 seconds, and
If you go more than 3 seconds, you're not moving.
yeah, what I want to say is that if you put multiple drops on and rub it together, it's as good as putting a tiny dab and doing it. So more drops is just going to go through the bottle quicker. And if you dab it, rub it, that's a second dose. So it's when you rub it is when you're actually giving yourself the dose.
So if you got a large area, you just dab in one place and...
It doesn't matter where you put it. Yeah, if the pain is all over your body, or it doesn't matter. You just one tiny dab and just
Maybe
3
have your
seconds.
hand for your knee.
Recommendation for tremors not relating to Parkinson's.
My recommendation would be the sciatica one for that. My experience with Parkinson's tremors has been that if I relax the smooth muscle, or the soft tissues, I'm going to say, of the back, that often has a big impact on the tremor. And I've also had cases of tremor not related to Parkinson's that relate to the soft tissue being shortened on one side and long on the other, and so the head is trying to compensate for that, and that can cause this kind of a head tremor, and similar kind of things with the arm. So the sciatica will relax those and may help. I cannot guarantee that it will help, but it's as good of a chance of helping as anything.
What I find helpful in your book is that he goes into more detail on each treatment and complementary treatments, like
Yes.
say if you have headaches and things like that. In my weight loss class, I have dozens of customers now doing the trank and the appetite together
Oh,
because
cool.
cravings is one thing, but the stress and anxiety of not meeting that craving is still there. So
Right.
the trank is complementing the fact that, all right, we don't crave that chocolate, but we crave the joy that we had in the stress and
Yes.
anxiety.
Oh, neat.
And so now
That's
that I
great,
don't have
yeah.
that chocolate melting in my mouth with that
Right.
Dove bar or ice cream, the trank is really complementing the not craving it.
And that also can be helpful with sciatica, the trank. It can be helpful with, if stress is a component, then trank is a great solution.
Now, see, I only get ready.
Any other questions?
What do you have for cancer?
I can't answer that question.
Yes, you can. You can answer it.
I can't
You can
answer
answer
that
it creatively.
What I would say is,
Hypothetically.
Chance.
what I would say, let me tell you what cancers are from a Chinese medical perspective.
Yeah.
Which are fire toxins, damp and cold, damp and phlegm accumulations, and blood stagnation.
Okay, that was the answer.
That was very good answer.
Yes?
Anything for parathyroid problems?
Parathyroid, no, it's so specific. It doesn't come up very often, but yeah, sorry, but eventually we'll get to it.
That's been my
Your guilt, yeah?
Like when I get up in the morning,
Yeah.
yes, like stepping down, I can.
When you first wake up, it's tight on you.
Uh-huh.
My guess is that of the products that I have out right now, the aches is going to be the best one.
Which one?
The aches,
The eight?
because part of that issue can be the bone. You could be standing a lot at work,
Yeah.
and it could be changing the shape of the bone. It could be the soft tissue of the Achilles heel being swollen and inflamed. It could be the soft tissue of the gracilis muscle getting tight, and aches would be good for all those
Aches.
components. Yeah. But my experience with that is that when it's a lifestyle issue, it's a lot harder to treat than if it's an acute injury. Because for me, I stand 7 hours a day treating patients. And so I wake up the next day, and some days it's more, I feel
I
some
go
days
like
not.
14, 16 hours a day.
You're up standing it. So, I would use that, I would consider using it right before you go to bed, so that when you wake up, you'll be as relaxed as you can possibly be, or right after work to try to balance any imbalances of the standing.
I try the allergy one.
Oh, yeah?
Yeah.
That work for you, I hope?
Yeah.
Okay, good. Yep.
Sorry, I'm going back to church.
Oh, okay.
Yeah.
Thank you very much for coming.
Yeah.
All these different ones and what you're talking about, is that on your site? More
Yes, the
detail?
Infusions.com, you can definitely find all these and the customizable ones. Some additional information about the products, although the book at the moment has the most information about the products. It's just been an issue of, once I came out with the product, I thought I'd have time to work on other things, and it turns out that they're flying off the shelf, so I actually just, production is kind of my main focus. Yep.
I ordered one of your custom for
Oh, you did?
hypothyroid,
Yes, okay.
and I just started using it, but I also take on more thyroid.
Yeah.
So now I want to find out how well it's working, so I was thinking I should schedule a blood
Right.
test, like when
Yeah.
I do, for the hypothyroid. And is it possible to get off the Armour using your
So,
infusion?
Armour is something that you are,
And
it's not prescribed, or is it prescribed?
it's prescribed.
So if it's prescribed, I can't tell you to get off of it. So
Yeah,
I need to say it that way. What I would say though is that you need to make decisions based on what you're actually seeing with the blood tests.
Yeah.
So if you're seeing that your thyroid is
Is it
bouncing.
possible for the thyroid, if it's been bad for 12 years to go back to normal. It's
Well,
normal.
let me give you this example.
Function.
Marusha, last time I spoke, Marusha talked not about the specifically thyroid, but she talked about this woman who has had hot flashes every single day for years, and she used the hot flashes treatment, and the next day they stopped and haven't come back. So when you treat the right imbalance with the right remedy, then the impact can be very huge, and my goal is for it to be curative. So the thylo treatment is going to improve circulation to the thyroid to balance imbalances in the nerves that might be impacting. Thank you for coming. Thank you. And so it's going to have clear swelling and inflammation there, so it can have some any
You said
infections.
thylo?
Thylo, it's
What
going to
you
be coming
sent me
out.
was hypo.
Yeah, well, that was because I didn't have a name
Oh.
yet for it.
Oh, okay. So it'll be the same thing?
Same thing.
Okay.
You just need to get
Yep,
one. I don't
thank
know
you.
if your camera-
Here, I'm going to turn this off now.